In the far reaches of Turkana County, distance is more than geography. It is the difference between access and neglect. In Kibish Sub-County, over 400 kilometers from Lodwar town, thousands of families live beyond the reach of routine health and essential services. Nomadic pastoralist communities here face immense barriers: mobility, distance, and lack of identification, leaving many not just unseen, but underserved. To bridge this gap, the county government, together with partners such as Amref Health Africa, International Rescue Committee, and many others, is bringing services directly to the people through the One Health Kimormor Outreach.
Wakati kukonjeka nakosa namna ya kufikia kwa hospitali, so ndio outreach kukuja, ndio mzuri na furahi wakati outreach nakuja.
A model that brings together human health, animal health, and environmental services and civil registration under one coordinated effort.
The story of Kimormor is quite interesting. It's a unique model which has served largely in Turkana County. We started here in Kibish. So far we have done 21 cycles, and we are back home where Kimormor started.
This integrated approach is powered by collaboration, uniting government departments, development partners, and community structures. And for 10 days, remote villages here were transformed into fully operational service hubs.
Kimormor in itself is a unique idea. It's complementary to the services offered by the county government because we have two strategies in terms of health, which is a static facility and outreaches. But Kimormor now complements the outreaches because there are areas where people through outreaches they cannot be reached because the population is on constant move, and thereby Kimormor bridges the gap of outreaches that is normally done by health facilities. The other uniqueness is we have a pool resource by various ministries, unlike other components that they do independently. For Kimormor, through other ministries, like 5 of them, we pool resources together with our partners, and we do a targeted outreach because we look for this underserved, unreached, the pastoral, cross-border, and the migratory population. In terms of cost-benefit analysis, we saw Kimormor. When we do this outreach of Kimormor, we spend around 280 shillings doing Kimormor, but when you go do independently, it is over 1,000 shillings. So in terms of cost-benefit analysis, Kimormor outreach model is cost beneficial to the population of Turkana County.
Close to about 2 years ago, we were grappling with how can we ensure we improve antenatal care services. At that time, we were probably about 53% of the population accessing antenatal care services. Really, that is quite low. That's quite low. And when we assessed, we realized that a good number of clients were not accessing because of their way of living and their culture and the way of doing things. We appreciate that about 84% of our clients are pastoral and nomadic. They migrate from one place to the other. So may I just say they are mobile kind of population. And indeed, when we reached out to them and had a community discussion, they advised us that we come up with a model that is responsive to their needs. In this case, that we come up with a model that can allow them access services to where they are. And that's why together we coined Kimormor, where now we package all services together and do it to the mobile population. So really, Kimormor want to achieve equity.
So far, we've attended to 6,892 human population, For livestock, we so far as of today, we are at 19,872 livestock either vaccinated or treated. With ID registration, over 700 applicants were registered waiting for their IDs. For birth certificates, over 213. And for SHA, which is a very critical component, we've seen almost 800 people being registered to SHA, and this has really helped us in terms of getting people to access health services through SHA registration. Before we came to Kibish, in terms of counties, we were rated at 47 out of 47, and in the last 2 days as shared by the county HRIO, we were 46 out of 47, and we attribute these efforts of Kimormor that has contributed to these numbers, and we look forward even to going higher. This is normally a quarterly activity, and we do human health, animal health, environmental health services, registration of SHA, water services, and civil registration, and also civil registration is issuance of birth certificates, and registration of people to get national ID cards.
Cases that are yet to have ever had any immunization, so we call it zero dose, and definitely this is the kind of clients that once we meet and serve, it improves the herd immunity of the county, because science tells us that for us to control epidemics and cause diseases largely around vaccination, then we should at least achieve 85% of the community to be immunized. So we are doing this to ensure we enhance. Currently we are about 66-67%, and I think that's a good improvement for the county. Other services that we do have within Kimormor, just to ensure that mothers are accessing antenatal care services, also having HIV testing services, nutrition, so that children who are malnourished, because get intervention around it. As well as TB screening, because TB second infection, especially for among clients who are living with HIV.
Wakati popote outreach kukuja, watoto wanapata dawa, wamama wanapata chanjo, anasaidia watu kabisa kwa njia yote.
Kibish Sub-County, 80% of the population are pastoralists, and we live along the border, and we have the risk of importation of diseases like polio, and currently we are even having an active case of Marburg, the Marburg viral disease in the Chinga region of Ethiopia. Yeah, so we are really privileged to have Kimormor, because it's giving us an opportunity to also census our communities. We reach out to more population, we census on all the diseases that we are currently doing surveillance, because once there is little water for hand washing and face washing, yeah, diseases increases, particularly the eye infections, yeah, and the diarrheal cases that we see in our facilities. Yeah. So what is helping us? Kimormor has actually created an impact in one. We are able to reach places that we cannot reach. It is really a plus, and it's creating a greater impact.
In Kimormor, the other service that is more important in Kimormor is about prevention. We are talking of prevention in terms of we are providing our pregnant mothers and even the children under 5 with nets that prevent mosquitoes bite. That is, we are preventing malaria. So we are really trying to make sure all the families are being covered. Every family to have a net, every single person to sleep inside a net, so that we prevent malaria and we reduce the mortality rate in our sub-county.
Where I am now from Napak is like 80 kilometers. Sasa hii watu hawezi tembea. Hii area ya Telo na Ormor Uwasa ni kati ya zile areas ambazo huwa hazifikiri sana na maana ya afya. Ndio maana usidi kwamba tunapata watoto ambao hata wale ni zero doses wengi hawajaipata chanjo, kwa mama hawajaienda chanjo hii. Kimormor imesaidia sisi kama watu wa Kibish kufikia watu. jana tuliweza kupata watoto wengi ambao hawajawahi pata chanjo. Watoto wengi ambao walikuwa 500 nchini ambao walikuwa hawajawahi pata chanjo. Na wengi tuliweza kuwapatia ile chanjo yetu ilikuwa na wapate shilingi 500. Hata wale sasa hivi tunapatia wale machanjo yote wanataka wapate in the 5 years at once. So sisi tunashukuru sana for this initiative ya Amref.
Before we see a patient, we have to undergo a process of SHA. After registration for SHA, that's when now we are going to collect the patient. If the patient needs some kind of laboratory investigation, we send them to the lab. That's when now we get the diagnosis, give the treatment, then the comment, then now release the patient for drug dispensation.
We are attending to children below 5 years of age. We are immunizing children below 1 year under the normal routine immunization. And then we also are attending to children who have missed any immunization or any vaccine who are below 5 years under the big catch-up program. And also, we are also giving vaccination to children, to girls who are 10 to 14 years.
We are doing ANC profile for the first ANC mothers, which entails HP, blood grouping, and VDRL, and HIV, the malaria investigation using MRTT.
We have experienced child who only came to the facility. When she came to the facility, she was only given one immunization. That's the BCG. So since where they stay here and the facility is far, the child never came back. And on our interrogation, the mother or the caregiver, she told us this place is too far from the facility. They cannot make it. So when we bring these services closer to them, they really feel happy and they really appreciate what this has come. The under 5s in Kibish Sub-County, we have a total of 2,400 children. Through these integrated outreaches, we can easily identify our active cases of malnourished children, defaulters in the form of immunization services, and even children with other childhood illnesses like malaria, pneumonia, and diarrhea.
The impact of Kimormor to our data as a sub-county does really helped us in defaulter tracing. In a facility, in a normal instance, in a day, we can vaccinate 2 children, receive 0 NC mothers because of this distance from their households. And then Kimormor coming in, it really helps us to reach these defaulters in these pastoral areas. But them coming here, we are privileged to start them, on NC profile, do for them HB, we give them IFAS, supplementations. It really boosts our data. After this Kimormor, I guess the number would be high.
Contribution of Kimormor as it is, we are serving a very mobile population. Kibish 80% of the population we serve, they are pastoralists. That means if there is no outreach, we are unable to reach this population. These are numbers that are going probably to improve our indicators so that we ensure our population is shielded or is well served to prevent vaccine preventable diseases. The big catch-up, which is really going to improve our numbers as a matter of concern, the follow-up on implementation of the newly introduced vaccines, such as typhoid conjugate vaccine, and then the second inactivated polio vaccine, which is administered at 9 months.
Medical teams treated over 2,300 people, providing life-saving care where none existed before. Over 18,000 livestock were reached, protecting livelihoods and sustaining entire families. Because in Turkana, human and animal and environmental health are inseparable. Hundreds accessed identity services, open doors to healthcare, education, and more opportunities. At the heart of it all are community health promoters, the trusted links between services and the people.
Alafu Kimormor atusaidia madawa ya watu pamoja ya mali yetu sahi na kufa iko kitu naitwa lotir, iko kitu naitwa lokoi, iko kitu naitwa lolewa, iko kitu naitwa enomokere. Sasa hapo yote natakana Kimormor yote atusaidie sisi madawa, ndio tusaidia mali yetu, ndio tusaidia wananchi yetu. Kimormor iko hapa yote na Amref na magari kadhaa yote amesaidia watu yetu.
Ile challenges zinakuanga naye kila mara na mara for the 5 years. Naona kama leo Kimormor imejaribu sana, na tunakaribisha Kimormor. Exercise itaendelea na tutakuwa tumecapture mortality number ya wanyama kuliko ile sisi tunafanyanga sisi wenyewe. Sisi tunafurahi, na hata najua large number, kwa sababu hii ndio water point, large number ya wanyama itakuwa imepata. Sasa tunakaribisha na tunafurahi kwa sababu dawa yote ya wanyama, ya binadamu na exercise ya vitambulisho, kila idara iko hapa.
Nashukuru tena ile Kimormor ametuwezesha kufikia mahali kama hapa. Mahali kama hapa si rahisi ufike, hii area yetu si rahisi kufika hapa juu ya insecurity. Lakini Kimormor wamefanya juu chini, tumefikia watu ndio wapate usaidizi. Itasaidia sisi kupunguza kazi. Mostly sisi mimi kama sasa community mobilizer, itakuwa rahisi hata mimi kufanya kazi yangu hii ya disease surveillance kama FP case, measles, rubella, neonatal tetanus, wale watu hawapati surface.
Tunaenda side nyingine ile ya dasana, tunaongelesha mambo muhimu ya amani. Amani tukikuwa naye watoto wanaweza kusoma vizuri, tunaweza kuchea resources ile iko katikati ya boda kama maji, nyasi na pia kufua pamoja, tunafanya vitu kama hiyo. Na pia amani inasaidia upande wa kufanya biashara. Sisi tukikosa vitu kama cereal hapa, tunaweza kutafuta huko. Na wale ya conflict inaleta hasara. Uwaji inaleta watu tunapoteza maisha.
Serikali yote iko hapa na tunafurahia tukiwa administration. Kimormor kwa miaka zingine zilizopita ilikuwa imetusaidia sana pakubwa. Maji yenye tunakunywa saa hii tunagawana na mifugo. Watoto wetu wanaumia kutoka hapa mpaka na park ni 25 kilometers trekking by foot. Sasa hii nikiongea nikiwa chief mdogo, mimi natakana nikae hapa hivi, lakini kwa maneno ya maji safi, mahali ya kukaa, network, ndio mimi nakaa huko na park. Mimi nikiwa chief nashukuru sana siku ya leo kufika kwa Kimormor hapa. Naomba Kimormor wapate pesa mingi sana kuja itusaidie.
For many, this was the first time receiving medical care or being officially recognized as citizens through the registration center.
Tatani kilo rotodana yang apa ya alam jangan sebutara. Erwala taran sebetulnya tong apa nih? Ada kerang abis kios wana kenanya tuh alam sebutara atau wana. Bakne tuh na amri bela karena lokal jokon. Aba na dia utri berbalik ya. Berbalik yang bel, ocak tuh ngarag nur ocak teri. Dia udah dalnya punya bunyi.
Aya ala kara to kana yang luki ja mga kurna ka jokon ibun to kana kwar na nakapan Kotere ya dia lagu ni ngataza kwa ni goye takanya lang pareng idulang tunga adang idulang deji Ezia elaine lazim labuni la tamama rupiana gele tola raina pasi kongna jikena kena kini pasi kongna Ezia de ngala tamata na pasi kongna hala karato kana lo kajo kana tamar ko e poloto je kiberien jikini yang tengah pro jikena ya tini ngake project Ezia ra ngake pro sawa jika ka tini ala karato kana ngai bere ni abala pak ngarakne tini poloto dang izina ka Kotere itu anake unit yalo deke alang bareng Ezia alang tunga Ezika ikai ala chane kadang aluara ya kali dia la dia ka no itu lo der tamadere dewa tayu ngedi pat ko ko pere jikini joko jikini ala karto kana alu ki jama ngatunga lu ya unto to ne dewa la parna ramakan ta santina ka tini
Ai karung to mano kan ka hei ngor kau na ngatu pandi kau na ngatu pandi ala karato kana alu ki jama Kimormor hanya ya uni akapande pelege chiketutu atau tuga kapande
Kimormor na anasaidia sisi ananifuata sisi mali yote na sisi niko kwa paka ya Marile na Turkana hapo diko katikati na mimi naye sisi ni watu ya Amoni ambayo wananifuata barabara hivi sio watu wa barabara ambayo wanakaa kwa kijiji sisi ni watu wa msituni sisi ni watu wa msituni tunashonga watu wa kushonga tunapata tu mali yetu sasa tumekuja hapa kuna hii magari ya Kimormor inaingia hapa Kimormor anakuja ananisaidia sisi kila kitu dawa nasaidia dawa ya ng'ombe nasaidia dawa ya watu hizi tumenipitia Kimormor asante kabisa kwa sababu tumenisaidia kila kitu
Toka One Center ni kilomita 20. Hapa kutoka hapa mpaka Ethiopia ni kilomita 30. So hapa ni karibu na boda. Tulikuwa hata tukawa tunaamini kama kampuni kama hizi inaweza fika mahali kama hapa tusaidie, lakini kwa maana yani ni furaha kubwa. Tumeshangaa kwa sababu hakuna kampuni imekuja kwa wingi na madaktari zake zote na vitu vingi sana, ili tumeshangaa kama tauni yote imeama kwetu na imetusaidia. Mimi kama chief niko na furaha ribo, niko na furaha zaidi. Mimi nashukuru Kimormor na serikali kuu na pia kaunti yetu ya Turkana.
Jokane Kimormor joko ye dewa lang tungali apoloko lang kaduko la ngakemak eyei dang lang akipi eyei porang akipande etubio elaina etubio nekije gintor wa berba Kimormor ngedineni.
We have quite a number of neglected tropical diseases here in Turkana that we undertake surveillance and do case management. One of the most rampant NTDs here is trachoma and kalasa. Those are the most, we have last year around October, November, we had kalasa outbreak in Turkana East and parts of Turkana Central. And we've been able, like we have done today, to sensitize communities.
Trachoma tracheitis is one of the major causes of blindness in Turkana, and one way of managing it is by surgery. I have my team, the TT surgeon and assistant, and we always accompany Kimormor teams because they help us in mobilization of these patients and also in reaching out to those difficult areas. And one of the things we are supposed to do is to operate all patients with trachoma tracheitis. We reduce the numbers to the one we can manage at the facility level. And secondly, we are also reaching out to population, giving AIDS education to ensure they wash their faces, because trachoma is a wash disease. If we get any case with cataract, we book them and organize on how we can manage them thereafter. So we feel privileged and we encourage Kimormor because it helps us to reach out to distance population, outreach areas. With combined Kimormor exercise, we are able to reach all our populations.
This is a TTK, trachoma. This is a patient with trachoma disease called in the stage 3 called trachoma trichiasis. Trachomatous trichiasis, the TT in bracket. So it usually takes us like 10 to 15 minutes, and then we are done. Then after post-op day 1, that's tomorrow morning he has to be reviewed, and then to see how he's doing. Then we give again treatment. Then we do another post-operative review after 2 weeks, and then after 3 to 6 months, then
most of them, especially the children, like the ones you can see here playing around the anthill, that you can see here, the pastoralist settlement. They can settle near their anthills, as you can see. And the children most affected by Kalaza are children mostly between 5 and 15 years. We take this opportunity for One Health Kimormor to reach those children, to do the screening. Those who meet the present with the signs and symptoms, we test them and refer them for health care. They start early treatment. So we encourage them to seek early treatment as a way of improvement of health-seeking behavior. We do community engagement.
Kimormor came to bring a solution around mobile population. And looking at when we started about 2 years ago and where we are, there are good achievements we are happy with. One, we have since improved the skill delivery. It's now at 65%. I remember I told you we were at 53%. So that's a good milestone. We endeavor to be above 80%. Then also when you look at maternal deaths, previously it was about 1,584. But currently we are kind of proud to say we are doing our best. Because currently we have about 381 per 100,000 live births. So really the goal is to ensure that we have a zero death around our maternal services. We also have been having good amount of challenges around climate change. We have had droughts that have affected nutritional stress to our communities. So when we did in 2023, the global acute malnutrition, it was quite high. It's about 26.8. The acceptable range is below 5. And when it's 5 to 10, say someone is poor, and about 11 to 15 serious, and anything above 15 is critical. You know, when we say we were 26, it just shows that we were quite high. So when it was 26, we had to also integrate it within the Kimormor so that we screen our mothers, we screen our children, and ensure their own intervention. And we are already seeing good fruits around it, because in 2024 when we did the assessment, it was coming down to 21.4. So our intention is to go below 15, and we believe we can achieve this as we continue working as multi-sectoral approach.
The vision is that we adopt as a county the vision that the national government, the Ministry of Health, as the one that checks on policy has given to us, that we have a productive county free of NTDs. Since immunization improved among the pastoral communities, we have seen a reduction in the cases of leprosy. We have managed to reduce the cases of trachoma to below 5% in most sub-counties. So that's, which is quite a milestone from the 42.3% that we had over 10 years ago. From the outbreak of Kalaza that we had last year, over 1,000 cases. Now we have reduced them this year the cases have far less below 500. So, and the mortalities have drastically reduced because of the interventions from government and partners.
We found old men, 77 years, 80 years, and the entire family who've never gotten their ID card. So it was an opportunity for them to acquire this very important tool so that they can access government services.
The reason for them not coming there, one, they need to look after their livestock, make sure they have enough water, firewood. So to them, healthcare service is not that much a priority.
Integrated animal health outreach is very key because we serve our pastoralists, which are almost 80% of the population of Turkana County. And therefore, animal health is the entry point for all the services to the communities. And so if we don't go as the forerunners in terms of animal health teams, then the other services might be dragged. We are targeting sheep and goats and cattle because those are the most commonly available animals in terms of the needs of the livestock community. We are vaccinating cattle against LSD. We are also providing supportive treatment to sheep and goats against various conditions. And we are targeting to vaccinate over 10,000 heads of cattle against LSD. And we are also, targeting to support various conditions, over 15,000 of various conditions in terms of treatments. And we are also undertaking veterinary extension and education in terms of sensitizing communities on zoonotic diseases that are prevalent within their habitations, and especially the common ones include rabies. Rabies is quite common in pastoral communities because 70% of human infections originate from livestock, and so it's very important for us to really train them on that. We are doing surveillance. We are filling Kenya Animal Health Biosurveillance System. It's an app that was established in 2018 by the Kenyan government, and it gives information on disease prevalence, and it's being reported from the community level by the CDRs and by the veterinary officers available within the wards and the sub-counties. And it's very key for us so that we get this disease report so that we can be able to promptly act and provide the necessary response that is required.
Tumeweza kukuja wakati ambao hao wa Ethiopia, hao majirani wetu wako wanaishi pamoja kwa amani. So ile mifugo yao pande hii na pande hii inaweza ku benefit mambo ya chanjo na pia matibabu aina mingi.
Anakuja kutusaidia dawa ya watu, dawa ya mbuzi, pia ni kufagilia wagonjwa zote. Sasa tunasema sasa Kimormor aendelee hivyo.
Kimormor brings all units of life together to see what kind of direction we have to take to make sure the environment where we live in is healthy and well organized for all, for peaceful existence. Mine is just to assess them why it's so much important to protect and conserve the environment, because now the world is changing in terms of the weather patterns. So we discourage them from cutting, most especially the mature tree species, and to have proper methods of removing the weeds amongst the grassland areas. Like now in Kibish here, we realized when the grass grows to some height, they use a method that we discourage them from using, like burning the grass. So the heat from burning reduces the viability of the soil chemistry. So it kills the nutrients in the soil. So therefore, the fertility is lowered, so the trees to grow or any kind of planting is lowered down. So we discourage them from using fire.
Kimormor naona imesaidia department yetu kwa sababu sisi mahali tunafika due to challenges mingi.
This place is majorly 180% pastoralists. Like in Gaza, you find we are only reaching around 20% people who are only settled kwa settlements kwa vijiji, of which now ni wachache. The 80% of the Kibish population, which is the pastoralists, is not reached. Sasa inakuwa challenge kubwa sana. Sasa mpaka wakati kama hii tunapata hii msaada, tunapata watu kama hao wenye wako mbali wanafikiwa, vitambulisho inafikiwa, na pia inasaidia serikali ku plan for its activities. Then wakati ile watagawa resources ya county, they usually distribute as per the population of the people in those areas. So
tumekuja na Kimormor kusaidia watu kupata jinsi vile watapata badi, kwa sababu wengi wakikujanga huko wanakuja wanatafuta hizo badi. Wakati mtu ameadimitiwa inakuwa ngumu mtoto kushughulikiwa kupata matibabu. Juu sasa hapa lazima wajase forms, chief wasign na DC wao wasign. Inawasaidia kwa maisha pia, kwa sababu saizi maneno ya maugonjwa na pengine mtu amepelekwa Eldoret, na pia kwa upande ya kukata kipande na pia ajulikane ni Mkenya. Kwa upande ya SHA wawezi saidika bila hiyo birth certificate, kwa sababu saizi kuregister SHA lazima ukate hiyo birth certificate ndio uregistiwe kwa SHA.
Na Safaricom inasaidia Kimormor under SHA because of maybe withdrawal, maybe for sending money, na Safaricom inasaidia for theft. Kwa mfano sasa mtu ameshika pesa kwa mkono, mambo kama hizo pia inaavoid. Ukiwa na SIM card inasaidia pia under communication. As from our team we can help the villagers to get that network for calling.
Kimormor imenisaidia sana kufikia wenye bado wafikangi hospitali. Kwa mfano kuna watu ni ngumu sana kufika hospitali, lakini nimefikia huko mashinani ndani huko, sababu nimewaambia wakipata maidi wa kuja hospitali na wakati mwanao baadaye. Imenisaidia kwa sababu inafika huko mpaka ndani, sehemu ambayo si rahisi wa kuja hospitali. SHA itakuwa imeongezeka zaidi, utapata manamba zimepanda sana.
We are in the process of developing a strategy because Kimormor is on a quarterly basis. Once we see this child, we are not sure if they will complete the immunization. So we are in the process of planning how best do we follow this child once receive the first immunization until they are fully immunized. So that's an idea that we want to track our kids because we have the documentation already to ensure that in the next 2 weeks or 4 weeks when they are due, a team will come and follow them to make sure that they complete the immunization services.
Tunasaidia Kimormor kwa upande wa kuipeleka watu kwa site kwa wakati wenye inafaa, na hiyo time ndio wakati tunakuwa na challenge kidogo, tunakimbiza wasaa ili ndio tupate wagonjwa mapema wasiwe wametoka, na time yenye tunaanza kutoka tunatembea kama convoy, na hiyo convoy inafika kwa wakati ambayo iko sawa.
When we go to the field, sometimes we get a breakage of the car, and when we have a breakage of the car, the staff will be late to reach on where they are going to the place or the site. And in a Turkana area, early in the morning, the livestock people, they have already opened the cows to graze. We need on the timing, we normally go early in the morning at 6. At 7 we need to be there.
Lakini tukiwa convoy, wakati tunapata pancha tunasaidiana. Mwingine mwenye yako na spare wheel anakusaidia ili ufike ndio baadaye uunde tairi yako.
In just 10 days, Kimormor reached over 6,800 people across 600 households, demonstrating that integrated, community-centered service delivery works. More than a response, Kimormor is a model, efficient, scalable, and rooted in dignity. In such hardest to reach places, Solutions are not just possible, they are already working. Kimormor is bringing services closer, restoring dignity, and leaving no one behind.
In terms of ensuring that the communities are well mobilized to undertake this particular exercise, we usually do like a prior visit with the local elders, the chief of this particular area, the kraal leaders, so that we are able to identify where the kraals are. We go specifically to deliver the message to them, to know where they are, who is leading them, and provide the exact information they need in terms of the services that we are going to offer, the timing, in terms of the days that we are going to spend here, and what kind of services are going to be provided during these One Health integrated outreach programs. Go with them in the Tree of Men or Ektoyankio, where we have a conversation with them. We deliver the message that we intended to deliver. Once we are in agreement, then now the kraal elders are going to spread the message to the kraals that are nearby and ensure that the communities are well mobilized to come for services the next day.
For us to achieve this, it's not just our own achievement or something. I think it's close collaboration we have had with the county, and we really want to thank the county for coming up with a policy on One Health, which is really giving us a blueprint on what exactly we should narrow around in terms of goals. So we look forward to a further engagement with the county, and thankful and grateful to the U.S. taxpayers, because through the Department of State, U.S. Department of State, we were able to receive funding, which has contributed immensely to this, and also to appreciate our donor for Project Daraja.
One of the issues that we've noted that it is not enough, because this is an integrated outreach comprising of all those people that we normally do on quarterly basis, depending on the resources, and having one outreach at a time, and we don't know when next we are coming. Since 2018, this is the time that we are coming in 2025 to see this, though we began these activities after 2018 up to 2022. We've been going to other sub-counties, the western side, the bordering the Lokiriama, Lokichogio, Turkana West, and Loima. So we are still in the process of having a county One Health bill, and this will ring-fence our resources so that when the county assembly, when it is passed, we can have our own resources and we can do this on a monthly basis by the sub-counties.
So this is something which as Amref we endeavor to continue working with the county government of Turkana, which we really appreciate, that has created a very good environment for partners to explore their potential and contribute to controlling the epidemic, as well as controlling any diseases that are ravaging our communities. And definitely we wish that we get more stakeholders really onboarding to
Kimormor tuko kazi.
Kimormor ilo kazi.
Kimormor tuko 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 kazi.
Ayelo kazi Kimormor.
Kimormor tuko do. Kimormor tuko kazi.
Kimormor tuko kazi.
Kimormor tuko kazi. Kimormor tuko kazi. Kimormor tuko kazi. Kimormor tuko kazi. Kimormor tuko kazi. Kimormor tuko kazi.
Kimormor tuko kazi.
Kimormor tuko kazi.
Kimormor tuko kazi.
Kimormor tuko kazi.
Kimormor tuko kazi.
Kimormor tuko kazi. Boom.